Welcome to the Bad Nurse Files. Today, we are going to be digging into bird flu and the CDC. So, in February of 2025, there was an article released about the CDC suppressing and not really informing the public of certain cases that were happening with bird flu and the flu. But we're going to focus on bird flu today because that's my fixation, if most of you know and you follow me. So today we dive into the CDC's February 26, 2025 spotlight update on the H5N1 bird flu. We'll show how the CDC's narrative doesn't really align with what happened in Missouri and why we should keep asking questions. So, on February 26, 2025, the CDC published a spotlight update on the US outbreak of avian influenza, confirming 70 human infections since April 2024. It emphasized no identified person to person spread and the overall risk to the public remains low. But let's pause though, because that's the official narrative. It glosses over what happened in Missouri back in late August 2024, a case we're going to talk about, and a case that a lot of scientists are still questioning if it was human to human. So, in August 2024, Missouri reported its first H5N1 human case. The patient was hospitalized after testing positive for influenza A, but had no known animal exposure. This is why I kept ranting about how the CDC just recommended subtyping and only critical patients and those who reported being exposed to cattle or farm life. So if you were just an outpatient positive for influenza A, you were not subtyped. And 75% of those cases were influenza A. So we don't really know how many bird flu cases we have had because we didn't subtype them. But they did for this person because they were critical. So this was unusual because this was the first case without any agriculture or animal contact. Excuse me. So the CDC downplayed it, saying the risk was still low and that no transmission had been identified. Yet the evidence kept on piling up. For example, a household contact developed gastrointestinal symptoms the same day as the patient, yet they were not tested. Soon after, at least six healthcare workers who treated the patient developed respiratory illness, but only five were later tracked. So none were tested at the time because they reported illness outside the CDC's 10-day monitoring window. But all that information still would have been crucial, you know? So Stat News later revealed that the four additional healthcare workers developed mild symptoms after contact, but crucially, none had confirmed H5N1 test, and health authorities didn't confirm if they had any antibodies to H5N1. So that would have been nice to know, right? So here's when things start to fill off. The CDC claims no onward spread, yet ignores that the household member got sick at the same time, making a shared exposure or early infection appear at least plausible, but that person was never tested. So we'll never know. Multiple healthcare workers fell ill after proper droplet precautions were in place, yet the CDC says none were infected. WHO's flu protocol emphasizes the antibody testing in such contexts, but has it been done? Data remains pending for now. We still haven't heard anything about these people. Public health credibility took a hit already with COVID. So this gives it an even bigger hit. So experts like Michael Osterholm question how long it took Missouri to identify these ill workers and then send their samples to the CDC. The delay worsened, of course, by Hurricane Helene disruptions. Coincidentally, maybe not. So let's fast forward to February 26, 2025. The CDC lists three new human cases in Nevada, Ohio, and Wyoming, all linked to animal exposures, no link to unexplained human transmission. Yet the Missouri case isn't mentioned as potential transmission risk. There's no update on testing results for the household members or healthcare workers. This absence speaks volumes. Of course, now we are short staffed, we are underfunded, but this was happening last year and it was still being underreported, still not with the right numbers, like I've been saying. So, what if the CDC is underestimating the risk or delaying the disclosures? Cases like the Missouri patient without animal exposure suggest possible undetected pathways of transmission, like human to human. I've suspected human to human since December, but I think they've been missing it. And now we're going to miss it even more that we've already stopped monitoring it because we haven't had a human case since February. So, illness in healthcare workers and close contacts weren't fully resolved or publicly detailed, and the 10-day testing window may exclude key data. The February 2025 update skirts over these unresolved questions while emphasizing animal linked cases. So we deserve transparency, releasing antibody testing results, obtaining clear timelines of exposure and symptoms and testing, and explaining why there's been delays and lapses in these investigations that are so crucial because this is a potential pandemic. The Global Virus Network already did a global announcement about that in April, saying that we need to get proper surveillance, we need to get better at finding treatment because this is a pandemic in the brewing. And in 2006, PubMed also put a global threat warning that this is a potential pandemic. So, and address also why we haven't revisited this Missouri's anomalies, given the potential implication that it shows us that human to human occurred. But if we don't talk about it, it didn't happen. So I'm not saying there's a cover up, but there's an unquestionable opacity, if you would say. Given the stakes of a potential pandemic, we need the CDC to lay out all the facts. Like, if there's nothing to hide, then full disclosure builds trust, right? And trust is not that good after COVID. There's a lot of vaccine hesitancy, and people have blatantly talked about not trusting their government because of what's happened with COVID. So if you're following this story, hit subscribe and ask, what aren't they telling us? All to stay in the know.